And we have more than 71,000 people who now have hepatitis. We have 1.7 million people with infectious disease. About 12,500 people suffering from cancer at risk of dying now. Salam alaikum, this is Sister Zainab, and I'm talking today about the future needs of the healthcare sector in Gaza. What I mean by that is not that I'm not talking about rebuilding everything that's been destroyed in terms of clinics. What I'm talking to you about are the people who have huge needs and particular diseases that have now occurred. For example, polio has re-emerged in Gaza, hadn't been seen in Gaza for 20 years. Due to displacement, we have more than 71,000 people who now have hepatitis. We have 1.7 million people with infectious diseases due to displacement. We have about 350,000 people currently in Gaza with chronic diseases. So, of course, there is no adequate treatment for all these people at the moment. We have 3,000 people with chronic diseases who actually need to go overseas to be treated properly. We have, what else can I say? We have more than 12,000 wounded people, and presumably because their wounds are so severe or complex, they'll need to receive treatment overseas. There are about 12,500 people suffering from cancer who are actually at risk of dying now because they don't receive treatment. We have the complexity, obviously, of so many amputees, especially amongst children. We know that there's trauma. So, what am I saying? I'm saying that in terms of the healthcare sector, this is not just about putting the buildings back in place and employing people, obviously where they're going to operate from anyway, because most of the hospitals and clinics are severely damaged. What I'm saying is that we actually need to find we need to find schemes, we need to find places for all these people who actually require treatment overseas to go overseas. And obviously we already know that there's a huge need for medication, even routine illnesses, normal illnesses. Ones that are not too complex are not receiving treatment. People are going blind because of that. And obviously with hepatitis, with chronic diseases, chronic skin diseases, there needs to be medication made available. And obviously even before the genocide, Gaza was blockaded and not everything got in terms of medication. But now it's almost totally blockaded. So maybe some of the stakeholders can follow this up, and maybe you can actually put pressure on people like this and just support whatever schemes you can to raise awareness and also try and find ways to deal with this huge need that the Palestinian people in Gaza have. And thank you, and this was Sister Zainab.